Freeman, good morning and thanks for checking in.
Hey, good morning, McGraw.
A couple of interesting stories here. First, let's talk about these e-cigarettes. A couple of studies are now out. Does e-cigarettes lead to more children smoking?
Well, that's always been the concern, and e-cigarettes are, if you will, we ever use this term, a disruptive technology, but they do seem to be a disruptive technology, and just as a conventional cigarette, an e-cigarette is a vehicle by which you deliver a very addictive drug, which is nicotine. Now, the jury is still out as to whether long-term e-cigarette use is as bad as smoking conventional cigarettes. So we don't know, for instance, that it be linked to, say, heart disease and cancer, and those types of things are as bad as with conventional cigarettes. But a big concern has been, will it lead to, say, people who ordinarily wouldn't smoke, would they take up e-cigarettes and then transition to regular cigarettes? And that's particularly a concern with young adults and adolescents. So this was a study out of USC, which is University of Southern California, and they looked at 10 high schools, particularly looking at ninth graders, and they just went in and said, how many of you ninth graders are using e-cigarettes? And they followed them over a 12-month period. And it turned out that at baseline, about 10% you had tried e-cigarettes, and when they resampled them a year later, they were several-fold, many times more likely to have taken up conventional cigarettes. So it's hard to read a lot into this, but certainly one interpretation is that people get hooked on nicotine at an early age when the brain is still developing, and it turns into a gateway to regular cigarettes, and that leads to a lifetime of very severe health consequences.
Anecdotally, I have had a few friends who had quit smoking, and the minute those e-cigarettes came out, they started smoking the e-cigarettes and was like, hey, I can smoke again, and there's no side effects, which is a dangerous game. It's still tobacco, right, doctor?
Well, it's nicotine. It's nicotine, which is addictive, and I think that one of the concerns that came out of this study is that there's a lot of concern that makers of these devices are specifically targeting them at a youthful market by, number one, the publications and social media that they're marketed in, and number two, coming up with these flavorings that young people particularly might find appealing. So I would have to say that, to be honest, the jury is still out whether, if your friends went from conventional cigarettes to e-cigarettes, that might or might not be a favorable thing to do with respect to your health, because, again, the long-term consequences aren't known. But I think it is very worrisome if we're seeing young kids take this up and then start to smoke.
Moving on to another topic, doctor, and I'm surprised this doesn't get more attention in terms of some of the social conservatives and the people angry with science playing God, and that is fertility clinics are now marketing the fact that you can pick or choose a boy or a girl.
So this is interesting, and I have to say I was also unaware of this trend, but fertility clinics are clinics that are really a godsend to couples that are infertile, and it works by in vitro fertilization, meaning that they isolate the egg and then the sperm and fertilize the egg and then reimplant it. And there's some clinics that do something called pre-implantation genetic diagnosis, and that's a fancy term to say they can look for, say, very serious genetic-based diseases that might run in a family, such as, say, cystic fibrosis or something such as that. But the other thing that they can look for is obviously the gender of the embryo, and a lot of this is banned in many countries, but not in the U.S. And for some of these clinics, this comprises a big part of their business, meaning couples come to them specifically wanting either a boy or a girl, and this appears to be a growing trend. It seems that the ethicists to date are somewhat divided as to whether this is a good thing or bad thing, but I think it is what it is, and I think it's an application of the technology.
Yeah, I that one is, it's one thing to not pick cystic fibrosis or Down syndrome, which I think some people would have a problem with that. You're literally playing God, and opposed to picking the sex. Let's say everybody wants their firstborn to be male, then you've skewed. There's a lot of questions about that. I'm surprised the ethicists aren't sort of more up in arms over that.
No, I would agree with that, and I share your surprise that it probably hasn't generated more public debate. And there certainly the question comes: is this a slippery slope to creating designer babies? Meaning, could you manipulate them genetically to have greater intelligence or be better looking or that sort of thing?
Or a right arm that throws 95 miles an hour.
Got it.
Yeah. Dr. Bradley Freeman, professor of surgery at Washington University Medical School. Thank you, doctor. Great as always. Have a good week.
Have a great day.
827 here, Big 550 KT.